I'm a senior house officer in surgery at one of the main London teaching hospitals. Essentially, I've graduated about 3 years ago. I've done my foundation training after medical school, and I'm now in my first year, or completing my first year of what we call core surgical training. So that's the path that I've chosen. My usual week in terms of a surgical trainee, it varies differently in different specialties, and I'm currently doing ear, nose and throat, which is ENT, and it basically comprises of ward round first thing in the morning. It's either 7:30, 8 o'clock in the morning, going around all the patients. You make a note of the jobs. You're working in a team, and you have a couple of juniors. I have some colleagues who are of the same level, and a senior colleague who's also going around the patients. After that, you sort of have to then manage your time. So it's whether you're on call. You might be doing an on call during the day. You have on call rotas where you're going to stay till 8:30 in the evening, and that's sort of once, depending on your rota, in 5 days, once a week. If you've got theatre time, so sometimes you're allocated to go into theatre for the day, and sometimes it's a mix. So we have emergency clinics, and then you might go into theatre. So there's quite a lot of different things. And
so in your first year, if you're in theatre, what kind of things might you be doing?
Okay, so my experience, I did orthopaedics, that was my first what we call house job. So that's foundation year 1 now it's called, but everyone keeps saying house officer, traditional term. And it was orthopaedics, and I mean, I love being in theatre, and mainly you're retracting. You're just sort of helping, assisting, trying to get the sort of view for the surgeon. But now and then you get to do some closing up of the wounds and getting to use like some of the instruments. And I think I had to go putting in some plates and screws, using drills, and it was very exciting.
Okay.
You know.
And by now in your third year, what sort of stuff
because I haven't. For example, the specialty I'm in now and the specialties I've done this year, they're all new to me. So I've never done that specialty, but it takes some time. So you go into theatre and you see the kind of procedures they do, and as you're assisting, you kind of develop that rapport, and then you're being trained and you're being shown things. As you're being shown things, then bit by bit you get to do a little bit more in theatre, and that's usually the way it works. So you see how a few operations are done, you get to do more and more of it each time until you can then do it supervised. And then I mean at the moment our rotations are 4 months long, and sometimes it's difficult to be doing all the operations completely by yourself at that time. By the end of that time frame, it's quite short. But essentially that's it. You're slowly developing your surgical techniques, and even what we call basic surgical skills, which you can apply to all different specialties. It might not be the specific operation.
Okay. And how did you find the whole sort of undergraduate, if you call it that, you know, your initial studies and then the transition and so on?
Yeah. My studies, I mean, I wasn't ever quite sure what I wanted to do. I mean, medicine, it's not just the science, it's got that social aspect to it as well, which I think is great. I don't think I myself didn't want to be in a purely science-based degree. So it's very varied, and it's so diverse. There's so many areas in medicine. There's very technical stuff, there's nuclear medicine stuff, there's the psychological aspects, public health aspects, and you know, the medicine, surgery. It's so broad. And I think I just went through medical school. I enjoyed certain aspects of the subjects I learned. I didn't enjoy other aspects of the subjects I had to learn. And actually it was when I did my elective near my final year, where I got to do stuff and see stuff, I actually started enjoying more because I was more involved. And then it made a huge difference to me working. I really actually enjoyed medicine when I started working. For me it was very different when you're a student and when you're the house officer, when you've actually finished and you're working. It's a huge transition. It's quite a scary transition, because all of a sudden you have this bleep that goes off, and you're thinking, okay, I've turned up to the ward. What do I do? The bleep's going off. What do I do? So it's quite an experience. But everyone goes through it, and all the nurses know that too. So they usually, if you're nice to them, they look after you.
Okay. And any general advice for someone who's thinking of setting along what looks like a pretty long path?
Yeah, it is. I think it's very important to know medicine, actually, quite like a lot of careers, it doesn't finish when you finish your degree. That's just the beginning. And I enjoyed my medical school life, so I take the opportunity and enjoy those years, because it can get quite tough after that. I'd say try and get as much exposure beforehand, or even during a medical school, into different areas. It is different, I have to say. Working in the specialty and having a bit of exposure at medical school can be completely different things as well. I mean, it's like, for example, specialty I'm working in now, you get minimum exposure at medical school, but I thought I'd hate it, but actually I quite enjoy it now that I'm working. But it's a long road. It's very competitive. Trying to decide whether you're going to choose family practice or medicine or surgery. In certain areas, like in surgery, it's extremely competitive, and you've got to kind of have the energy and the drive and the motivation to keep going. And sometimes working the long hours or random hours, and you're not quite sure where you're going to be every year. You get told, you're changing rotations all the time, changing hospitals all the time. There's lots of factors like that to consider. You could be placed anywhere. And it's very competitive. You've got to think about publications and audits and all this governance, and there's a lot more things to take on board nowadays because they've reduced the training, so everything's becoming more not compressed, but you have to try and decide sooner and try and get on the ball to make yourself like basically a sellable candidate. And I think medicine before was never like that, and I think it's probably like that in many other like careers, but we're just not used to that in medicine. But you've got to be able to sell yourself and think there's plenty of people around you who are multi-talented and do lots of extracurricular activities as well as being academic. So you've really got to be realistic about what medicine's actually going to be like, and how it's if you've got a family, like some people have young families and other factors, and that might help determine what even if you do medicine, what career you're going to choose from then on.